Fail to plan is plan to fail. Poor planning is the biggest factor for complications in the treatment process. In this, I'll tell you all the important questions that you should ask and what specific information to request prior to an implant surgery. We'll introduce you to the most important step in the implant planning process so that you're well informed of what to expect. Now, let me tell you a story. We recently had a case of a patient who'd been treated in a popular dental tourist destination while he was desperately looking for help. We had unfortunately turned him away, and here's why. The patient's x-ray showed an implant which had penetrated the sinus. This was a clear sign that the implant had been placed in a compromised position where the jawbone is very thin, apparently without adequate planning or a 3D scan. There are such cases indeed, and this is why you need to make sure that you'll be examined with a 3D scan and then get the surgeon to discuss the scan with you. After all, this is the most important examination prior to surgery, and you have the right to know everything about it. So, how is an implant surgery properly planned? It all starts with an on-site examination and an X-ray. This is the initial examination that will give you a general information about the patient's case and the presence or lack of enough jawbone for implantation. Here's an example of a panoramic photo. While the X-ray is a good tool for getting a general idea of the patient's case, it's unfortunately not enough for a definitive conclusion of the presence of enough bone for implantation. The 3D scan, CBCT, however, is a three-dimensional X-ray examination and requires more advanced equipment. The equipment cost is significant and quite often is provided as an external service, and not every clinic can afford it. If the 3D scan is external to the clinic, it would usually take a longer time to receive the result and to analyze it. The 3D scan is one and only test that gives 100% clarity on how thick and dense your jawbone is. Only with a 3D scan, the surgeon can make an objective decision where exactly and what type of implant to place.